Hey friends, I just wanted to real quick show you this self-massage exercise I use for my forearm flexors. So this is great for anybody who does very arm, elbow, wrist centric sports like HEMA, fencing, anything like that. Also tennis, golf, all those things. So what I'm going to do, this is a technique for the flexor muscles. They all attach up at the condyles of the humerus via the common flexor and extensor tendons, which is where y'all will get your tendonitis up here. All right, so I'm just gonna find a surface roughly like this. You can use a table, anything like that. I usually like to take the corner so I have enough room, all right? And I'm gonna start, this is for the flexors, so I'm gonna start with my hand my wrist in a flexed position like so. I'm gonna take my forearm on the other side. I'm going to use the proximal 1/3 of my ulna right here, okay, this bone. And I'm going to sink in here firmly, but I wouldn't say like all the way to the bone deeply. And as I come down slowly, I'm just going to come into extension like so, okay? Nice slow stroke, okay? You don't want to be using a lot of lubricant for this, okay, or really any lubricant, because you want to grip on the tissue so you can get a nice hook into the fascia, into the myofascia, into the soft tissue, and you want a feeling of carrying that wave of tissue down toward the wrist, okay? And you see I'm getting my body weight over this as much as possible. Of course, it's always a little awkward to do these techniques on yourself, but you make do. All right, so then when I'm done with that, I'm gonna turn it over and I'm gonna do the extensor side, okay? So for this one, I like to grab the tissue and pull it a little bit medially, all right? And you can use this kind of windshield wiper or levering mechanic here. So notice my hand is fixed and I'm using it as the fulcrum, and then the rest of the arm becomes the lever, okay? So the motion is like so, all right? So gonna pull over, and same as I did on the other side, I'm gonna start in wrist extension and I'm gonna slowly come down. And I'm going to try and time that movement roughly with my stroke, okay? Now, as always with these techniques, they should feel good, okay? You might feel a little bit of burn there, but shouldn't be painful as such, okay? Hope that helps.